Good morning. We begin our program this morning talking about the topic of aging. It has definitely become a big talking point in this year's political campaigns, but we wanted to dig into how we age, what we lose, when we lose it, and why aging looks different in different people. Here to answer some of those questions this morning is Dr. Jaclyn Olsen Jaeger. She's a geriatrician at the UConn Center on Aging. Welcome.
Good morning. Thank you so much for having me.
So I want to start with a general question. I think we all see it. Obviously, it's become a big topic in the news lately, how people age, but we all see it in our own families. Is there any common milestones, or is really everybody different as they age?
Yeah, I think that's a great question because we like to say that when you've seen one older person age, you've truly seen only one older person age because there really is a lot of differences as people age. There are some usual things that often can happen as people age, and we do age from head to toe. So everything from our brain, our heart, our lungs, muscles, bones, all ages throughout. But based on how people lead their lives, whether they're good exercisers or eat a healthy diet, avoid smoking, alcohol, that rate of aging can sometimes change.
Is there some point where it would be expected there would be some deficiencies compared to that person's younger age? Is there a milestone age that you watch for in patients that you follow?
Yeah, so the traditional age that we consider people geriatric it starts at 65. But again, everybody ages differently. I have some patients in my practice that are in their 70s and 80s that are running marathons. And then I have other patients that are much younger that are not as physically active or cognitively intact. So age truly is just a number, but 65 is what we consider the beginning of geriatric patients.
You talked about some of the factors that can speed aging. And of course, we're talking about this because it became such a big topic in the presidential campaigns. And we've often seen in the media, and I think a lot of our viewers will recognize this as well, looking at pictures from the first day of a presidency to the last day of a presidency, Barack Obama, who was quite a bit younger at the time than the current candidates, going from a dark head of hair to gray haired and more wrinkles appearing on the face. Can that age people as well? Can stress, can a certain job? Is that something that you would factor in the same way you would say diet and smoking?
So stress is a well-known factor that can impact aging and cognition. So people that report higher levels of stress can have changes in their cognition. And similarly, people with changes in their cognition often report higher levels of stress. So it's really important to try to mitigate some of those risk factors, such as stress load. So a lot of people ask, should I continue working after the usual retirement age of 65? And it really is an independent choice. If your job is challenging, exciting, and makes you want to get out of bed in the morning, that is something that we would, continue to encourage you to do. There's also a very large socialization factor in employment oftentimes, and that is also good for cognitive health. However, if you dread going to your job or you feel that you have high levels of stress due to your job, that might be something that you might want to factor into how you address your cognitive health.
It kind of made me smile a little bit to think about whether the president of the United States would dread getting out of bed to go to work. But if that was whether it's president or a CEO of a company or a U.S. senator or something like that. So if everybody's different and maybe the work that you're doing and how you enjoy it plays a role, if someone came to you and said, hey, I'm thinking about running for this huge public office, I want to make sure I'm up to it. Is there a battery of tests you could put them through to determine if they are?
So that's a great question. So there are some screening tools that we can use in outpatient office settings to see if people do have any cognitive changes. These tests can take anywhere from 3 minutes to 15 minutes, or even longer ones can take up to 3 hours. But it's important to understand that these are screening tools. These are not diagnostic by any means. So looking at the full patient as well as their lifestyle and how they act day to day. So are they able to manage their bills independently, manage their medications, do higher order things like grocery shopping and cooking? Those would be things that would also be really important in terms of determining how a patient would be able to function and make judgments and decisions.
Is there have studies shown if age limits on some of these things are effective, whether it be the CEO or the president or a U.S. senator say, other than doing this half hour a week, I'm a lawyer, and I was talking to a judge. They have a 70-year-old mandatory retirement age. And I said, Judge, I feel like you're on top of your game. I hate to see you retire. And he said, I feel like I am too, but I see some of my colleagues and I don't think they are. And I'm glad there's a retirement age because I think they would have a hard time walking away from this. Is there any research on whether, whatever the age is, 70, 80, 90, that works?
Yeah, no, again, it's a great question. There is no specific number per se that we say, okay, once you've hit X number, we really need to, restrict what you're doing. Some industries have started doing cognitive testing for patients that do have a significant impact, potentially, doctors, lawyers, et cetera. But again, age is just a number, and the heterogeneity of aging, meaning how people age so differently, is so individualized. And when we think about, when we treat older patients, we really are getting into an area and a space that we recognize needs to be individualized because it's just so varied among people.
We got into this, of course, because of all the talk in the presidential race, and the stuff you've said today is so fascinating. I'm so glad you could be with us. But I want to ask you this as we're starting to run out of time a little bit. Most people aren't going to deal with it because they want to run for president. Most of them, it's going to be because Graham isn't paying her bills or Grandpa doesn't seem like he can live alone. Are there some factors that you should watch for, whether it's a loved one or, like you said, maybe it's a lawyer, maybe it's a doctor, maybe it's some other professional that's aging? Are there some telltale signs that even if it's not someone that you can bring to you for an exam, you might say, I should be concerned because of what just happened?
Yeah, yes, for sure. So 45% of all dementia or cognitive impairment worldwide can be attributed to 14 risk factors. I won't go into all of them today, but some of the big ones that people should be aware of are vision loss, hearing loss, history of diabetes, history of high blood pressure, physical inactivity, meaning that you're not getting the recommended amounts of exercise, poor diet, lower education status. So any of those things, and as well as smoking and excess alcohol intake. So those would be considered a lot of the modifiable risk factors. So making sure that you're eating a healthy diet, making sure that you're getting your recommended physical activity, seeing your primary care clinician, and getting your hearing and vision checked. These are all things that we often think about as we get older, but it's something that people in midlife should also think about too. And if your family or loved one is experiencing any of those things or changes such as getting lost while driving or difficulty managing bills or medications, you would definitely want to talk to your primary care clinician or a memory specialist to address those concerns.
So interesting, and even through the lens of a political race, probably some news you can use for our viewers and their loved ones. Dr. Jaclyn Olsen Jaeger, thank you so much for being with us. We appreciate all the insight this morning.
Thank you for having me.